Hi, folks. Welcome to this episode of Perspective on Perspectives, where we have conversations with authors from Music Therapy Perspectives, a peer-reviewed journal detailing clinical advances in music therapy that's published by the American Music Therapy Association and Oxford University Press. In this episode, we speak with Feilin Xiao and her authorship team about a publication from a couple of years back entitled Factors Associated with Music Therapy Board Certification Examination Outcomes. In this study, they surveyed music therapists about test-taking strategies and their test-taking profiles because they wanted to have a better understanding of not just the test itself, but the test taker, about attributes that lended itself to passing versus not passing the exam. Reading from the abstract, they say the results suggest the need for a consistent standard for education programs that includes various theoretical orientations and clinical practice models to better prepare students with content knowledge, and program progression policies to identify students at risk of failing the examination and to provide remediation. In this episode, we unpack this a little bit more and we talk about where future research in this area can potentially lead so that we can help competent music therapists to be able to pass the exam and move forward in their careers. Thank you for checking this episode out. Please follow us on social media platforms, including Twitter, Facebook, and Instagram. Our handle is at AMTA Research. That's at AMTA Research. Please feel free to leave us comments on any of those platforms. We are always happy to engage, and thank you for being a part of the dialogue. Since we have four authors for the very first time on the podcast, let's take a moment for you to introduce yourself. Let us know where you are, what your affiliations are, where you're teaching, where you're working, and you can fill us in as well as to what your role was with this particular project.
Okay, let me start. Hello from Stockton, California. This is Feilin Xiao. I'm an associate professor of music therapy at the University of the Pacific, starting my 15th year of teaching this fall. I'm the lead author who coordinated the study. My responsibilities included reviewing the literature, establishing the conceptual framework, collecting and analyzing both quantitative and qualitative data, and writing up the manuscript for publication. I'm glad that I have my co-authors to help me throughout the process. So next, let's go to Shelley.
Hello, I am Shirley Tan. I'm an associate professor at the University of Bergen in Bergen, Norway. And I am the second author of this article. I was involved in the very, very early conversations with Feilin back in 2008, actually, where I remember that we first started this conversation. I will talk a little bit more about how this study came about. So I was involved in some of the early conversations and also involved in the planning of the questionnaire, the formation of the questionnaire that went out, and also the analysis process and the writing process, more on the quantitative aspects of the study. So, okay. Maybe next we go to Jonathan, who's the third author.
So hi everyone, my name is Jonathan. I also go by JT. I'm currently right now the senior music therapist at Extraordinary People in Singapore. So I'm currently based in Singapore. And so my role, part of this research, it kind of came, I was kind of added on as the conversation continued. And so I think it was with Shelley and Feilin that we kind of had another conversation on this and really encouraged us to pursue this line of research. I think it was talking with some members of the CBMT and other people who were just generally interested in finding out what reasons or what was happening with people on the CBMT exam. So for this research, I was part of the the literature review was looking through some of the different aspects to measure. I was part of designing the survey as well. And then part of the manuscript writing and data analysis, I was more involved in the more qualitative or narrative responses, so coding those kinds of responses. Yeah, and now I'm going to hand on to Jen.
Hi, everyone. My name is Chen. I'm a music therapist and a licensed mental health counselor. I am currently living in Boston and working at a lab focused on autism, and also, in the meantime, working at an outpatient center focused on adults, depression, anxiety population. And I am the last one joined in the project, and I helped with the initial some literature review and also mainly design the survey questions and also some data analysis.
So I didn't realize that the genesis or the roots of this project stretch as far back as 2008. So I'd be really curious to hear, Philin and Shuli, what led to this initial conversation, and then how did it begin to take shape over the course of from 2008 to 2015 when data collection began?
Yeah, and then in 2008, Shaylee and I, we co-presented a CMT course focusing on the needs of international students.
Yeah.
And so one of the topics was to address the board certification exam. So at the time, a few CBMT staff members attended our session. And since then, actually, Karen Hoey at a CBMT has been referring me international students who have difficulty passing the exam. So while helping those students, I have always had a question in the back of my mind, because how come my own international students always pass the exam at the first attempt? So what factors kind of contributing to the success of these exams? So that's where it kind of came about. And then maybe Sherry can talk more about, when we started in 2008.
Yeah, we host, like Faylene said, we hosted a whole day of CMT focusing on international students, but the conversation has been ongoing, and then of course we were both pursuing a lot of different things at the same time academically. So this kind of, we talked about it every year, and we also, when we go to conferences, we go to the CBMT booth, have conversations with them. So it seems like there's a lot of anecdotal speculations about why people pass and what are the reasons what are the obstacles people have. And then when we try to find something in the literature, there's really nothing. Those voices are not heard. We have never documented people's experiences in taking those exams. So that led to the formation of the questionnaire, and you can see that the questionnaire and the questions that we ask have extended way beyond just focusing on international students. And it's really looking at everybody's experiences, because I believe that some of the anecdotal, rhetoric that's happening out there, it doesn't hold true. But we don't have any evidence to disprove of that. And so we decided to, when we designed this questionnaire, it was way beyond focusing on international students.
Yeah.
Yes.
Yeah, I think the timing also is good, because in our field, right, just at the point when we started the study, we found out about the decrease of the first-time passing rate nationally. And so a lot of distressing people out there. And therefore, not only international students failed the test, other students failed the test as well. So that's why that got us really interested and motivated to start the study. And also because both Shirley and I, we passed our exam long time ago. So that's why we need Jonathan and Jen, who passed the exam recently, to join us. So we can have newer information as well. Yeah.
What I really appreciate about the study was that it allows us to, what I hope, have a shared starting point for a conversation about how can we help prepare people? How does it, so that they don't feel as if they need to turn to somebody random on a social media forum, but actually can start to turn to something, rigorously analyzed data that can indicate what in fact might be helpful. So to that, I was surprised that 49% of respondents found their internships to be helpful or very helpful, given that the exam is competency-based and not knowledge-based. In other words, I would have thought that internships would have been more helpful. These internships are where you start to take the book knowledge in classroom and start to apply it in the clinical practice for the first time. So I'm curious what thoughts you have about why that might be the case. And is that due to perception on the part of the student, or is that a shortcoming of our current internship model?
Yeah, and I didn't really think about this question. So first, I would like to point out that, let me read the question in the survey to you. So this is a question. In your opinion, how helpful was your internship in preparing you for the exam? So I found out that some of the respondents, they took this question literally. So they only thought about if they received help from their internship directors for preparing the actual tests, such as receiving information about preparation strategies or providing resources. So some of them actually, because we also asked them for comments, some of them did say, okay, in terms of preparation of the BC exam, it's actually not internship director's responsibility. So some of them, they did have this mindset. And then, but you know, it would be like half and half. Half of the respondents did think that the internship helped them apply the knowledge learned from coursework to clinical practice. And then as a result, they are able to answer hypothetical questions related to clinical scenarios in the BC exam. But then, however, I do agree with you. It does bring up a question. Does the BC exam only assess textbook knowledge? Especially some respondents suggested that when they suggested for the test takers, when they approach those clinical scenario questions, they should only look for textbook answers. Yeah, so it does bring out a good point when the test taker, they are reflecting on how the future test takers should approach multiple choice questions. They say, hey, look at textbook answers only, regardless of what you think, textbook answers. Yeah. So I wonder if other, like Jonathan or other people, do you have, Jen, you want to, share your thoughts?
Yes, that reminds me one of the data we collect, which is a open-ended question. It's the original question was asking issues with clarity of the wording. The original question was like just ask you their experience, anything you want to share of your own experience on taking the exam, and it's optional. So the people, like 1/3 people, participants left comments, and there's like 19% of people talked about there's an issue with the clarity of the wording of the test questions. And yeah, I think that might be something challenging to the people who had some real clinical experience, because it's like, because I took both National Mental Health Counselor exam and the music therapy exam. They both have a lot of scenario questions. It comes to me, it's like one type of the scenario for the scenario questions for the National Counselor exam. It's more like a strategy oriented. And some of the question on the music therapy exam, it more seems like to result oriented. And they're looking for some result-oriented answers. That might be one of the challenges. People have some, real experience, might have the challenges to pass the exam.
That's interesting. That makes me think about sometimes the messy boundary that exists between CBMT and AMTA, where they're supposed to be separate entities, but more and more there's an overlap. And so I think sometimes that test takers go in and think, I only need to look at the domains that comes out of CBMT, although AMTA scope of practice and the competencies are not fully divorced from the items. So those are still guiding documents and to help the test taker to determine this, the proper result, Jen, as you so well put it.
Yes, so similarly, when we asked this about internships, preparing them, we also asked the same question about how well do they think the study program prepares them, and they asked them to rate on the same way. And I think this is this has been one of the, this conversations going on for a long time too, about whose responsibility it is eventually to prepare the students, because some people, I think there's still some up in the air as to whether faculty's responsibility, the program, or is it internship. Because from this 49-51 is kind of a, it's almost 50-50, right? So the thing is that some people might think that it's an internship because that is the last point of contact that they in their academic career before they go into professional status. So they would think that, okay, at the end of the internship, there might be something that will help them with preparation. And then there'll be others who think that, is this the academic program? Because that's where the academic work is based, and it's the faculty's responsibility to kind of, after 6 months or 9 months, however long the internship is, to have this kind of a wrap up with the student to prepare them for the exam. So I think that when we constructed the survey, we on purpose put these 2 questions in and see what is the perception of where they think that the preparation should be, or should be coming from, actually. So, and that point, that the results, and then also built in the open responses to this question too, they also give us a lot of thoughts about where people are thinking in terms of who's responsible for preparation.
So to that, where do you feel preparation for the board exam, where should that happen? Where would it be? What's a critical developmental period at which being introduced to the exam and the content of the exam and how to pass the exam, what seems like the most apt?
I think it's hard to say. For me, and again, this I think goes back to the question on the internships, right? Why some people felt the internships was useful or not useful. Thankfully, I was in an internship that kind of had a broad range of experiences. When we think of internship, a lot of people would specialize maybe in like a nursing home, in a geriatric facility, or in a medical facility, or in a somewhat specialized area that doesn't cover the whole spectrum of what the CBMT covers, right? It doesn't cover special education if they've only worked in like a medical setting, or vice versa. If you did your internship at a special education setting, you wouldn't have knowledge, or you wouldn't have the practical experience. And so I think that kind of gives maybe the impression of why internships are not as useful, because it only just covers a small aspect of the CBMT. As for myself, I thought my internship was quite useful in some regards. Again, like I said, I was thankful to be in a place where I had a broad range of experiences, working with adults as well as working with some children. And so for me, I think what helped me personally is really just going back to reading up on the textbook and catching up on areas that I did not have experience with in my internship. And I think back to Shirley's point of like, whose responsibility is it too? Like for me, I did an internship that was on the other coast from where I studied. So I studied on the East Coast and I did my internship in the West Coast. So to get that support from my educators it had to be like through email. Now with technology, with Zoom, I think it's very helpful to have these kinds of conversations with your professors, but also finding their schedules, like when are they available, when are they able to help, given that they are teaching as well. So that throws in another layer of complexity in terms of like, how is the school going to support me if I have like a 3-hour difference and I'm somewhere far away. So for me, I really mostly rely on the books that I had. Thankfully I didn't throw away any of the books that I had. So just reading up on those kinds of things and just studying, I would say.
My internship in both a community center. Hi, my name is Chen again. I did my internship in a community center and also a state psychiatric hospital. And I passed the National Mental Health Counselor exam on the first try, and I failed on the music therapy exam multiple times. And it was super frustrating for me to understand what happened. And I think my internships are both very useful. Preparing me to be a therapist, not early to help me to pass the exam. And I have a classmate that passed the exam. Even Jonathan passed on the first try. We're both international students. He had a very good, like easy time to pass that. But I really was struggling and really have a hard time to understand why, like what happened. So that's also one of the motivation I joined this research study. And I guess, I'm sorry, I guess what comes to me, my personal opinion is really, I feel like a standardized exam should hold a lowest bar possible, not to build on ideal scenarios. Because music therapy clinical intervention is all about creativity. Like there are multiple, like many ways to be the good intervention in terms versus the question, the student were asked to choose the right one answer. It really can be challenging for people with real clinical experience, especially they come from very different internship sites.
Right. And I think you're hitting upon something that's really important. I think it's why, in part, why we're seeing such a steep decline in passage rates. It's that music therapy is getting more and more specialized. Our knowledge of certain clinical areas is getting deeper and deeper, and it's getting harder and harder to try to cram all of that into a 4-year degree and have students being able to complete the program with equal breadth of knowledge across all these different settings as the literature continues to not just quantitatively increase, but also just to qualitatively become more nuanced in terms of the type of knowledge that we're introducing.
Yeah, so I want to add a little bit from the educator's perspective in terms of preparing students. So at least for undergraduate students, I usually really talk about the exam, not spending a lot of time before their internship about really remind them they do need to prepare for the exam and really think about how to approach the exam in terms of test taking strategies, how to approach multiple choice questions, and be aware of the test anxiety, and then so how to prepare, and then resources. But for undergraduate students, you can only remind them so much when they go to the internship. They forgot about everything. And then so right now what I'm doing is starting their 4th month of internship, I start sending them resources. And then my student actually suggested I should do a boot camp before they take the exam. So I'm thinking maybe like creating some kind of podcast like this or a webinar, just to kind of prepare them and really remind them they do need to practice for the exam. And to answer some of the questions about the increasing knowledge in our field, they're so diverse and all that. Recently, I mean, pedagogically, after this kind of study, I've been thinking about how do we teach, because you can only cover so much within 4 years. It's not about the what to teach, it's how. It's teach them about how. So I think it's more important really for them, for students to really to understand how to approach clinical scenarios and then practice clinical reasoning, making clinical judgment. And then because, as you notice that the board domains just came out 2020, suddenly you're facing a lot of new questions. And then so some of the educators are very nervous because, we taught them about, we base our teaching on 2015 domains. What happened? How do we prepare them for 2020? But then, to be an ethical music therapist, actually in our field, knowledge is updating every moment. So I think instead of feeding them all the facts, actually instead of that, it's really teach them how to make sure that they are updated with the most current evidence-based information, how to find resources, and how to really, like I said, it's very important to practice clinical reasoning skills. Yeah.
Yeah, that's just like the strategy oriented versus goal or result oriented.
Yeah, I think
I'd like
yeah.
to give some context about because if you haven't read the paper yet before you listen to the podcast, or you want to read it after, I think I want to give some context as to where our responses are coming from, so it helps to frame the results. The majority, we have over 600 respondents to the study, and the majority of them are came from a bachelor's program. How much? 65.7% of them, of our respondents, have just finished their bachelor's degree. Majority of them are in their 20s. Majority of them passed the exam at their first try. So we have a lot of people who are quite successful in passing the exam, who took our survey. And
Yeah.
also the majority of them, where their school is and where their internship site is in the same region. So that gives some context as to where, where this whole conversation actually, where we are basing the results are based on this pool of respondents.
Yeah, so the national passing rate right now is 70%, but our respondents, 85% of them passed the exam at the first attempt. And they're a group of people with high GPA, self-reported, of course, and low test anxiety. But then they're still very enthusiastic in terms of sharing their knowledge and their experiences. Yeah.
So that's something that we haven't touched on yet, is you're finding that test anxiety was predictive of the outcome of taking the exam.
Yeah, so, I mean, most of the respondents, they don't have really like high anxiety, but then between the two groups, so people who fell the first time, who passed the first time, we did see the differences. So I think it's important for students to be aware of it. So I think for students, maybe the last time they've taken this kind of time, computerized multiple choice questions, it was like SAT maybe. And so they were not aware of the test anxiety and how that kind of impact their taking behaviors and then results. So it's really important for students to really take advantage of the practice test and then go through it as if they're really taking the exam, and then see how they react to that. And then actually I do have a few students, they found out that they do need accommodations after they did the practice exam, or maybe after they failed the first exam. Like, okay, they do need accommodations. Sometimes they were not really thinking about it. So that's one thing that's really important for the test takers to know. And then also how to manage the test anxiety and also prepare themselves beforehand. That's really also important.
So what role do you think educators can play in terms of helping students to manage that test anxiety?
So interestingly, we're music therapists. We know how to manage anxiety. We're practicing, we're doing like relaxation techniques and all that, and then also mindfulness, cognitive reframing. We know all about it, and we just need to really practice on ourselves. And so, it's so interesting. I think sometimes students, they don't really think about those techniques for themselves. And so maybe making a connection and prepare themselves. Yeah. I don't know if any of you have other tips you want to share. Yeah, Jen.
Well, not necessary tips. I would highly recommend people to really go back to read our paper, because we do have the data to show that the mean of OTT, the mean score of the first time taker, the score was lower than the multiple time test taker. However, the standard deviation was higher than the multiple test taker. That means it indicates, even for the first time, people who passed the exam for the first time, some of them might still have a very high anxiety score. Well, so I'm just trying to say that anxiety might be part of it. I mean, everybody will feel anxious to take on any kind of standardized exam. It's very common. And it seems like from the result of our paper, it was not necessarily the only thing to like prevent you to pass in that, if that makes sense. That's my interpretation on that data.
Yeah, and then so in our article, since Chen mentioned at the end, we have appendixes in terms of how to test taking strategies recommended by the respondents. Of course, just be aware that it doesn't work for everybody. But then I learned actually from the study that so like check out the test. So to minimize all the kind of anxiety provoking kind of possibility. For example, visit your testing center before you even take the exam. Make sure you bring extra layers of sweater or whatever, and then maybe check on the rating of the testing center. Some of the people are really mean there, and it's kind of like, and then really noticing that maybe you're the morning person versus afternoon, and just kind of be aware of that, and then so kind of minimize those kind of other factors.
You're hitting on something which came to mind for me as I was reading the study, that there's different types of anxiety. And I wonder if the thing that the test taker was feeling anxious about in some way determined whether they were going to be successful or not at taking the test. Because for some people, anxiety can actually be, it can help them to channel and focus. It gives them this adrenaline boost that they need to really lock down. And for others, anxiety leads to racing thoughts, and it leads to really strong physical responses that can distract your cognitive abilities from being able to take this really rigorous exam. So if it's, I can think back to when I took the exam back in 2000. It was the first time I ever took a test on a computer. And I sat down and never really realized before, this is going to require a different sort of engagement from me than when I've always taken tests with pen and paper before.
Yeah.
I have some response to that. When I took the exam, it was in 19 and it was not on the computer. It was pencil shading on the circles. So I think one thing that was I taught in the United States before, and one thing that was very striking is and I'm thinking of just the different levels of students, right? We have bachelor, somebody coming from bachelor, somebody coming from equivalency, master's equivalency, or masters. And so I don't know in how many opportunities they have to sit in a room for 3 hours and dedicate 1 minute for one question. That kind of pressure, I don't feel like when I took the exam, then it was like the whole 4 years I never had to do that. I always had time or it wasn't all multiple choice. And so that was very real. It came very strikingly real for me when to sit down and have to do that 3 hours, I think. And specifically the measurement that we used in the study was specifically looking at test anxiety. So it was not looking at general anxiety. It was very specific, and that was what we were measuring.
And I think, Noah, you mentioned something good. Like, I think that's an area for future research in terms of what kind of anxiety are they facing. Is it almost that, I think it's the different theories is similar to like theories of stress. Is it like a positive stress that moves you forward? Or is it that kind of stress that pulls you back? So from our study, it's really looking at that high stakes, because CBMT is like a high stake exam, and it kind of, I think people, whatever experiences that they have is only with like the SAT, which is, I think, computerized. I did an SAT pen and paper. I don't know what it was. But I think like Shelley mentioned, we're trying to tease out all these different factors. And when we gathered the data on those test taking strategies or test taking formats, these are the factors of test preparation, doing the test itself. Well, not significant, but I mean, it's good to just be aware of. I think our paper has the appendices of like what some people thought on those test taking strategies, being in the room. Some put like, bring a sweater, bring some snacks, because it's 4 hours. You're not gonna last throughout, don't be afraid to step up and walk out of the room, those kinds of things. And when you're in that moment, when you're in doing a high stakes test, you kind of just forget not just what you need to do, but forget about taking care of yourself. And that's where the anxiety kind of spikes. You do not know how to answer it, and then you're kind of cold, you're freezing, you just had a bad experience at the front desk, receptionist who was rude to you. So all these many different layers really contribute to what might affect someone's test taking ability. And I think just our study just touched the tip of the iceberg in terms of what really is influencing or what is really affecting test takers and their perceptions on what helps them to be successful.
I want to add a little bit more as an international student. Before I come to the US, I need to take those like English tests. That's also like 2 to 3 hours long and super difficult to take. So I was kind of familiar with this kind of formality, but it was really the content of the question. Kind of, I was struggling on that. And my anxiety went very high after the second time filling on the exam because I don't know what happened. I did everything good. I just don't know what else I can do. That's where the anxiety went up.
Yeah, that's I really appreciate you bringing up that point, that sense of helplessness on the receiving end of not having passed and asking yourself, what can I do to make this better the next time around? And it's in part, I think it's both the strength and a weakness of the exam. Statistically, it's a strength. It's reliable. It means that people who pass the test are going to keep passing it, and people who fail the test are going to keep failing it. And that's ultimately, it's a good thing with a standardized test. But at the same time, it does make it hard to know how best to support students who do good work, who are clearly competent in the services they provide, but are struggling with the exam itself. And so then thus we then struggle with how best to help them to be prepared for passing it.
So I've been thinking about like future practice, right? Just like, how do we go from here? So one thing I do think about in nursing field, they do have the exit exam. So almost like a standardized practice exam. So really, really similar to the real exam. And I wonder, right, if we will like to administer that in our field. A lot of the respondents, they complained about the practice tests, saying that they're too easy. So they got really, really good scores using the 2 practice tests. And then when they were taking the real test, they realized, oh my God, that's very different. The test questions are longer, it's more complicated, and yeah. So maybe one of the way of thinking is maybe creating some kind of exit exam, or maybe a practice exam that's a little bit similar to the real exam. Yeah.
An exit exam is a really fascinating idea. Our School of Nursing has that too. I think they call it the HESI exam.
The HESI.
Yeah. And from what they've told me is that passing the HESI is very, very highly correlated with passing the, I believe it's the NCLEX.
Yeah. So I've been reading about it. I was like, well, maybe that's one thing. So student can really actually experience the re-exam before, and then follow up. We can do some follow up remediation and those kind of things. Yeah. And Jen, you want to, yeah.
Yeah, just add to what Feline just said. On the maybe it's for the future researchers to explore the scoring system, because I took both the exams, the National Council examination. They have an option on scoring from positive 3 to -3. Like the one question, they give you 6 different scoring. Like some questions worth like 3 points, some are -3. So on scenario questions, it makes more sense. I think like there are some questions you definitely don't want to choose, or answers you definitely don't want to choose. Some answers are definitely good, some are better. That just makes more sense in terms of scenario questions, the scoring system.
I'm struck by looking at the passing rate and how it's decreased from 84 to 79 to 70%. So I'm curious your thoughts on where does this leave us moving forward in terms of, are we okay with 70% passing? Does that seem appropriate? If it's inappropriate, then what thoughts do you have in terms of how we can get that percentage back up without lowering the standards for what it means to be a competent music therapist?
Actually yesterday I had a meeting with the competency review board. We were talking about this. So according to one of the members, within the industry, okay, related field, the 70% are okay. So I actually look it up. So social work, around that. Occupational therapists, 70% around that. I think SLPs higher, PT higher too. So that just I try to look at the numbers, right? And using the words from the one of the members saying, within the industry, the 70% are very typical. Just what you mentioned before, because so this is a test that can really discriminate between, people who are making the entry level or not. Yeah. But then I don't know if do you have other opinions about the passing rate?
Is now essentially what we're saying, that this exam is the gatekeeping that's happening, right? This is essentially the gatekeeping that's happening. And our results show two things were very significant predictors. One of it was GPA, and then the other one was test taking. So really whether that test is really looking at competency, or some other personal factors like anxiety, like test anxiety. So it's really it's a complicated picture that has multiple factors factoring in passing this exam. So I think that when we look at cumulative GPA in the study. So we're looking at the students overall in the 4 years program or 2-year program, how they did in general. So then the test anxiety factor comes in also. So it is multiple things that are factoring into. It's not just competency. I guess that's what the study aims to look at, because this study the questionnaire is pretty huge. And I would say that, Faylene has more data in her computer than what you're reading right now, because there's just too much to get onto a paper into a journal. So we really looked at everything. We look at personal factors, we look at perceptions, and we look at very hard data like GPA and standardized test anxiety. So it is a more complex picture. And I want to say that what we as researchers, we have all this data, and we are hoping some of it might be, be very straightforward. There's the strategies at the back that are useful for future exam takers. But we hope that this is also illuminating for internship directors, supervisors, faculty, CBMT, AMTA, that all of these different bodies will be able to take out pieces of it that will be helpful in their conversations forward, as to training, as to exams, setting the exams, the item analysis for the exams questions. And that's what I think what we hope to do with that this data could be used.
And one perspective that I would like to talk about is some people mention about how do we measure clinical skills. You don't really actually testing them about that. And so I've been looking into the literature, and then I read about this idea of standardized patient cases. And it's like, it's some kind of clinical testing that, add on to. So if you are thinking the BC exam only measure the book knowledge, and you want to test the clinical skills, and that's another direction. But of course, the scoring could be really subjective. That's another thing. Yeah.
So the GPA component of the findings are really fascinating. On the one hand, you have students who are saying schools need to prepare them more, but on the other hand, high GPA is predicting successful passing of the exam. So it brought up questions for me, which is part of why I love this study, is because for every data point you provided, I had like 5 more follow-up questions, which to me is always the mark of a really great study. So I look at that and I think, so are programs doing their job? And thus the students who are high achieving in those programs are better prepared for the exam? Or are these students with high GPAs, are they just high achieving students with lower test anxiety, with greater resilience, with greater resources to draw from? It doesn't matter which program they came from, they were probably going to be well primed for taking the exam anyway.
So we have 85.6 people passed the exam on the first try. And of course, you also know 41.9, only 41.9 agree or strongly agreed that the exam reflected their competency, and 43 agreed strongly that internship helps preparing. So my understanding is the participants might attribute to the result of passing the exam to whatever they were using for preparation, because this is also one of our limitation on the study, which is the population was very homogenized. And yeah, I guess that's one of the reasons. And also the GPA was self-reported. So if the person is attributed to whatever they did right, they might also have a higher, self-evaluation. I did better in school. So that's one of the reading on that data.
Perhaps we can approach this from people who actually disagree, or they don't think that the program is very helpful. Some of them really mention about the test itself doesn't really reflect their educational experiences. So meaning that the test itself is really broad in terms of the content, but then the education they receive may not be so broad. And that's another issue of one of the kind of recommendation we had at the end is like the inconsistencies between programs, and they probably learn one approach, in school, and then on the test they were asked to answer, different questions based on different approaches. And so even though they pass the exam, but they still feel like unsatisfied with the clinical or educational training because they probably need to kind of learn those knowledge themselves. Yeah.
I feel as if you begin in the conversation, begin to move in this direction. And this is always my favorite part of these episodes, is to ask, what's next? What do we not know? Or what has this study shown us that we don't know, that we need to know? What data is best going to serve future test takers? What data is best going to serve future educators and supervisors in terms of preparing students? What does CBMT need to know in terms of obviously not just the design of the exam itself, but just the setup of the design, the test taking sites, the resources that are made available for them. Where does future scholarship need to shine a light on in order for us as a community to be most successful in helping test takers successfully pass the exam, and do so in a way that feels gratifying?
Yeah, I think we have already touched on that a little bit, as really looking at, for me, I want to look at the CBMT exam itself on the past, present, and projecting to the future, and how we can maybe modify the exam and maybe look into other fields to provide some examples. So like what I just kind of suggested, maybe an exit exam, maybe some standardized patient case. So that's one thing I've been thinking about. Another thing, as an educator, I think pedagogy, in terms of teaching, I want to think about how I can really, really teach clinical reasoning and clinical judgment. Like I kind of mentioned before, is really teaching students the how instead of the what. And so they have the critical thinking skills when they are facing scenario questions. They can find the best answers based on the best evidence provided. So that's the true direction I've been thinking about the follow-up studies. Yeah.
I mean, other areas too, really zooming in on those, because again, like our sample was quite homogeneous. So really zooming in on different groups of people, maybe those people that passed the first time, and really do maybe more in-depth interviews into what helped them, and also for those that maybe did not pass the first time, or those that have failed, and really getting to know what their issues are. And I think that can be informative in terms of many different things from an educator's perspective. What are they struggling with? What do they need help with? From an exam perspective, like what if are they understanding it right? Are they not understanding it right? So I think maybe, like I think what Faden was already mentioning, taking many different perspectives. So we have some educators' perspectives and some of the participants or different groups that we can really look into or zoom into.
Yeah, we have a very, like Jonathan was saying, we have a very homogeneous group of respondents. And I think if you just look at table 1, the very first table we have in our article, and just be able to splice up, we try doing that, but our sample, we have such an overwhelming sample in one category that we couldn't do the comparison. So if you look at let's say, for example, the program type, somebody could have like 430 respondents who have a bachelor's degree, and that makes up 65.7%. And even taking that one category and do a comparison between the different program types could be a further exploration of the study or a further expansion. And looking at another thing that we were really interested in was to see whether proximity to their academic program was another factor. That helps people who did the internship at the same region as where they got the education, would they have more support? And we were not able to look at that because the majority of our respondents were from the same region where the program, where they graduated from. And also we were also interested to look at whether somebody who waited, let's say 6 months before taking the exam, as opposed to somebody who took the exam, the week after they finished the internship, would there be any difference in the time lag in how long they wait? Then we look, does it make a difference? We don't have that data, it was not the focus of our paper to look into that kind of data. And also we couldn't also look at very closely at international students, because that pool was pretty small in our respondents. So we couldn't come up with any definitive kind of conclusions about that. So even looking at table 1 in our paper article, there could be so many further research that can be generated out of this, going more in depth into these pockets of samples.
I think one suggestion from the reviewers when we were going through the process was really look at students who need accommodations, because the increasing number of students with disability who require accommodations. So that's maybe another group of students we probably need to figure out what types of accommodations they need, and do we provide enough support for them.
Another thing is, I am actually very interested in the people who keep falling this exam. This exam seems like really some people can pass it very easy without preparing, according to the comments they left in our survey. But some people just keep falling, because I was in a Facebook group where a group of people, like up to 300 300 or 400 people was in that group, right? And it was a big group. Some people are kept falling, and I would really like to know if the future researcher can do some research on that. And I remember one of our conversation in the early stage of designing the question, we were talking about if the test kind of divided, like filter some divergent thinking or convergent thinking. That's one of our way, but it was just too complicated to put into the survey. We didn't put it into it, but that can be something for the future researcher to further explore. And another thing was something I mentioned earlier is the scoring system, maybe to compare with other standardized exam in the health or mental health field.
Yeah, I mean, that's a big theme that I'm hearing coming out of this, is that we don't need to try to reinvent a wheel that other fields have already finally crafted, and that there's a lot for us to learn from our colleagues in terms of how they are acting as gatekeepers, or putting into place the gatekeepers. So before we sign off, I just want to check in if there's anything that we have not yet talked about that seems something really important about the board exam itself, something particular to your study, or just a thought or idea that comes to mind from this conversation.
Yeah, one thing you mentioned about the international students, right? So I look into some articles, they talk about linguistic bias. And then I also, so they really examine the questions and to see if they're like linguistic bias. Maybe that can be one of the future study. And also some respondents, right now we're so aware of, multicultural and what's going on right now, is to really look at if the test itself is really US centric and those kind of things, to see if we take care of all the populations that, maybe they are not exposed to certain populations or the means to do what. And yeah, those kind of things. I think maybe that's something we can in the future can kind of talk about. But right now in our field, we're talking about all there are a lot of issues with like social justice and like you say, availability of all kinds of resources. And
Yeah, because from a social justice lens, that it's critically important that we don't make it harder for international students to become music therapists and practice in the United States. We need more voices that are different than 80% female, the 80% white demographic that we currently have as a makeup here in the States. And so the gates that we do put into place, it behooves everybody, it behooves the field, and ultimately behooves our clients for there to be a great diversity. So thank you to each of you for coming and lending us your voice and sharing your expertise coming out of this study. It is very much a needed piece of research within the field, and it's my hope to see that you guys continue to develop on this knowledge base, and I look forward to seeing how other researchers and clinicians and supervisors and educators and students will benefit from this knowledge and guiding us in terms of how we can help prepare future students, and also help guide CBMT towards a test that's more inclusive and fair.
Can I add one last comment? So if you're listening to this podcast and if you are also struggling with the exam, I highly recommend to read the last 2 pages of our research paper, and hopefully you can find some support there.
All right, that's a great way to sign off. Thank you all.
Thank you.
thank you.
Thank you, Noah. Thank you, everyone. Good night.